Welcome to the Dr. Remina Panjwani Show, where we're optimizing wellness together. I am your host, Dr. Remina. Welcome back to another amazing episode. I have an amazing guest today, Dr. Yousef Elyaman, who is a board-certified internist with a cross-specialization in pediatrics and a leader in functional and integrative medicine. As the founder of medical director of Absolute Health in Ocala, Florida, Dr. Elyaman has revolutionized primary care by integrating functional medicine into an insurance-based model. And beyond his practice, he serves as a consultant for Quest Diagnostics, the medical director at Human, and the founder of FMP Essentials, where he provides in-depth training on functional medicine topics, including his comprehensive NAFLD course. He also leads the integrative initiatives at the Guest House, which is a premier trauma and substance abuse center. He's a respected speaker and faculty member at the Institute of Functional Medicine. He's dedicated to educating both practitioners and patients on holistic science-backed approaches to health. When he's not transforming patient care, he's enjoying his ranch with his wife and 7 children. So, welcome. I am so grateful to have you here. How are you today?
I'm good. Thank you for having me.
It's interesting to have 2 board-certified internists, but also functional medicine. But what's going to be an interesting perspective is, combining all the things we do, but focusing on thyroid. I know there's so much we could go off of, but let's start with part 1. Let's start with thyroid. How about, what is the thyroid, right? Like, we know it's an organ that's in your throat. It's shaped like a butterfly, but it has so many functions. Let's run down on the basics.
Okay, so the thyroid is a butterfly-shaped gland that's in our neck, and it is responsible for energy and metabolism. And so people that have low energy, or people that are having difficulty losing weight, or people that are maybe having hair loss, they all could be suffering from having hypothyroid or low thyroid, and also it's responsible for, if you look at the different systems that can be off, it really interacts with most systems. So, for example, if your thyroid is low or high or overactive, you can have high blood pressure. And if your thyroid is low, before you start treating somebody's high cholesterol, you got to get their thyroid in order, because it can throw that off. So, fatty liver disease. I've been doing a lot of speaking on fatty liver disease because I have that fatty liver disease course. With fatty liver disease, if you look at the number one, the only FDA approved drug for fatty liver disease, it's called resmetirom. And what it is a thyroid agonist. So it can do what the thyroid does without affecting heart rate. So it's very important and very often overlooked and misdiagnosed.
Oh, absolutely. I like to think that thyroid just mimics so many symptoms, kind of like the gallbladder, where it's a great mimicker, but of course a different body part. So with the thyroid, it does so many things and it presents in so many ways. Before we go into some very subtle presentations, let's cover additional basics too. So when you have all these symptoms, and you go to, this is where conventional medicine kind of misses the boat, I feel like, where you have normal, but then you have optimal. And with that being said, of course, when you see in conventional medicine, you just get basic labs. So let's kind of dive into what basic labs versus what an expansive thyroid panel looks like, and then what optimal is.
Absolutely. So if you look at the basic test that most primary care practitioners, endocrinologists, internists, most are going to look at, they're going to look at the TSH. And what the TSH is it is the signal that comes from the brain that is telling the thyroid gland that, hey, you need to make more thyroid hormone. And that signal, if the higher that signal, the lower your actual thyroid hormone, because what happens is that the body kind of gets on alert and is like, oh, wait a minute, you don't have enough thyroid hormone yet. Let's increase TSH. Your thyroid doesn't have enough hormone yet. Let's increase TSH. So it will increase that TSH as long as that mechanism is working to try to get the thyroid to make enough thyroid hormone. Now, if you're lucky, the conventional practitioner will also check what's called a free T4. So there's a total T4, which some will check, or a free T4. A total T4 is the total amount of T4, which is one of the two thyroid hormones that we have floating around in our body. And it is looking at not only the amount that is free that can do its thing, but the amount that's bound to protein as well. And so it's giving you this kind of total number. The problem is that when it's bound up, your body can't really use it as well. So that's why the other test, and this is like the ultimate test in kind of the conventional world, is if they check what's called a free T4. And the free T4 that's looking at how much thyroid is available, or how much of the storage kind of form of thyroid is available to the body.
And now, where do you think the role of the reverse T3 comes in?
Right. So now you have, that is kind of that overview, that TSH and the free T4 is what most conventional practitioners look at. But what happens is that T4 has to become something called T3. And T3 is the major active thyroid hormone. Now, the issue with that is you can check a T3 level, but when your TSH tells the thyroid make T4, and it also tells the thyroid make T3, and it makes, for every T4, which is the storage piece, the storage type of thyroid hormone, your body will make about, for every 10 T4, it'll make maybe 1 T3, and some numbers say maybe for every 13 or 14 T4, it'll make 1 T3. The T3 can go into the cells and it can work where it needs to work, and it does its thing. The T4, there's debate about whether it has a role in itself, or does it just have to turn into T3? So for the T4 so most will say that most of it has to turn into T3 so the body can use it. But you mentioned a good point. You mentioned, well, what about reverse T3? In certain conditions, the T4 that we have, instead of converting to T3, will convert to reverse T3. And what reverse T3 will do is it will block number one, it wastes a T4, so it doesn't become T3. It doesn't have a biological kind of activity. So it doesn't help metabolism. It doesn't help with energy. It doesn't help with cholesterol. But the other piece that we think is that it may actually block those receptor sites, so T3 can't hit those receptor sites. And one of the biggest reasons that your reverse T3 will go high is stress. Chronic, long-term psychological stress will make that reverse T3, your T4 waste the T3, go into reverse T3. And then by doing that, now your TSH looks normal, your T4 looks normal, but you have a low amount of thyroid. And this is for the people that their doctor told them, or their practitioner said, look, you have a normal thyroid, there's nothing wrong. And they have all these symptoms of low thyroid.
Oh my goodness. And so much to that because, well, first of all, let's highlight how important lifestyle is, right? I mean, you talk about stress. We live in a world with stress that is just go, go, go.
Right.
And then you have underlying trauma. Then you add in like the environmental toxins that all inhibit certain areas of the thyroid pathway, right? And so then the other important factor that you mentioned is everything looks normal. So before we dive into all the effects of the lifestyle factors, let's talk a little bit further about what is normal range, normal versus optimal.
Yeah, I want to add two more tests though.
Sure. Oh,
So
yes, of course.
people, you can check a TSH, you can add a free T4, which I wouldn't even look at a total T3. I'm sorry, a total T4. You can look at a free T3, but the technology we have for that test isn't optimal, which is why we also get a total T3, which is the amount of T3 that's bound and unbound. And then we also can check thyroid antibodies to see if our body is attacking the thyroid gland. And there's something called anti-TPO antibodies and anti-thyroglobulin antibodies. And when you see that, when that starts to elevate, that's telling you your body, your thyroid gland is being destroyed and your body is attacking it. So now, I'm sorry, your question was? Your question was optimal ranges, right? All right.
Yep.
So the optimal range. So TSH is that signal from the brain that says, hey, you have enough thyroid. And according to the lab, as long as your TSH is zero 0.4 all the way up to about 5, you're good. Your body thinks it has enough thyroid. But if you look at the Endocrine Society and so many other societies out there, when they really looked at the literature, what they came up with is that honestly, your TSH should be between 0.4 and around 2.5. That seems to be that ideal range. So if that level is, if that TSH is 3 or 4, that higher normal, it may not be normal. Now, for some people, it could be their normal, and that's why we look at the other factors. But in general, if you can, especially if you have somebody on thyroid hormones, if you can get that TSH to less than 2.5, but not less than 0.4, which is one of the biggest mistakes that I see integrative and functional medicine practitioners make. They get their TSH suppressed so low that like their thyroid now doesn't even have to do any work. And that if you too much thyroid can end up with heart arrhythmias and so irregular heart rhythms and thin bones, and there's a lot of negative to over treating thyroid as well. And that's but if you can get it between 0.4 and 2.5, that seems to be the sweet spot.
Mm-hmm. Oh, yes. And that's so important when when you're told normal, like everything is fine. That's a huge range.
Yeah.
So I think as we're expanding on this part too, let's identify what the difference between, if you go to a regular conventional approach versus the tools that we have as functional medicine physicians. There's so much we could do because we consider lifestyle, right? Like if you go to conventional, then
Yeah.
we'll throw the famous drug like Synthroid, right?
Yes.
But let's dive into why that doesn't capture the entire root cause.
Okay. So Synthroid is really a T4. And like mentioned, that T4 is usually what most conventional practitioners are going to look at. But what we're looking at is we're looking at the T3 as well. And with the T3, my range for T4 is just get the T4 within normal limits according to the lab. Why? Because T4 is the storage form. T4 has to convert to T3 to have its activity. But remember, if it doesn't turn into T3, it can turn into something else, which is reverse T3. And reverse T3 kind of blocks the thyroid, or at least blocks the ability or gets rid of one piece of metabolism. And I'd like to take it back just a little bit to why would the body do that in the first place? Why would the body waste its thyroid hormone? Well, because the way we're designed like animals. And animals, when they were stressed, their life was in danger. And when their life was in danger, they either couldn't find food or something was trying to make them food. And either way, they'd have limited access to fuel, to food, to resources. So instead of stopping the thyroid gland, when you're under a lot of stress, your body thinks that there's maybe a food shortage. So what the body ends up doing is it starts wasting the thyroid hormone, turning the T4 into reverse T3. And by wasting it, you still have the TSH and T4 looking fine, but now you don't have that faster metabolism, because if I can't find food, I don't want a high metabolism. But one of the problems, if you look at some of these food plans that people go on, or some of these diets that people go on that are so low calorie, it actually tells the body thinks, oh my God, we're starving. So it actually then will cause your reverse T3 to go up and your T3 to go down, and it's going to make you slow your metabolism. So that's the why. That's the why the body does that. But then when we look at ranges, that there are going to be two ranges to look at. The range that I usually look at is I'm going to look at what we call a ratio. And I'm going to take your total T3, someone's total T3 level, and I'm going to divide it by the reverse T3 level. And when I do that, if that answer is greater than 6, then your T3 level should be okay. But if it's less than 6, then that means that you are releasing a bunch of reverse T3 instead of T3. And it means that your body is slowing down your metabolism, making you feel low energy. Because if you have high energy, you're going to run around and burn it off, right? It's going to make you also, it's also going to slow your metabolism so that you can hold on to weight and hold on to fat, because your body doesn't know when you're going to be able to find food next time. So then there's one more ratio that you can look at, and that is looking at the free T3 to a free T4 ratio. And the goal is going to be that should be greater than 0.33. So those are the ratios we look at, and based on that's really where it's at. You make sure the TSH is okay. You make sure the T4 is within within range, and you make sure that either the total T3 to reverse T3 ratio or the free T3 to the free T4 ratio are optimal. And that's kind of what we look at for optimal. And then the next piece are the thyroid antibodies. So you take a look at those thyroid antibodies, and if the body is making thyroid antibodies, there is a autoimmune process that is happening where the body is attacking the thyroid. And then from a functional medicine point of view, we will jump in and try to do whatever we can to try to reverse autoimmunity or the body attacking itself. But then you mentioned, what do we do different with functional medicine? Well, the first thing is we're actually looking at these ratios. And these ratios, looking at total T3 over reverse T3 or free T4, free T3 over free T4, that's not something that just functional medicine practitioners came up with. That's something that researchers are looking at when they're trying to discover what's happening in the body. This is something that's well established. As a matter of fact, the reason they came up with this FDA-approved drug for fatty liver disease is that they found out that patients that had a higher total T3 to reverse T3, a lower free T3 to free T4 ratio. Those with the lower ratios, they ended up having higher chance of having fatty liver disease. That's kind of how they were able to figure that out. Going back to how we would treat it, the first step, it all depends on what's abnormal, but assuming that your TSH is fine, and assuming that the free T4 and the is fine, we look at the ratio. And if that ratio is off, meaning that we don't have enough conversion of the T4 to the actual T3, that's when we're going to kind of look first to nutrition as a functional medicine practitioner.
Oh my goodness. And nutrition is so big, because I'm sure there's so many cases, like in my practice, of course, the most common root cause when it comes to nutrition, well, first is the gluten that creates that autoimmune mimicry. And then, of course, you got the nutrient deficiencies, right? Like
Right.
selenium, iodine, etc. So I'll let you elaborate on that.
Yeah. So nutrients. So you need enough vitamin D. You need certain B vitamins like B6, B3, B2. You need enough vitamin E. You need zinc. You need iron. You need iodine. You need all of those things.
So
And
much. So then should people like take supplements, right, for everyone?
yeah, I wish we could do it that I wish we could make put all those supplements in one pill and make it a tiny pill. What really in general we want them to eat 6 servings of vegetables and 2 servings of fruit a day, and try to have diversity to try to get it right. We want to work on healing their gut, but there are a couple of key nutrients that I'm going to be looking at, and I may be supplementing, sometimes testing and sometimes not. I think it's a no-brainer when you're looking at the thyroid to check iron levels, and in particular ferritin. And of the ferritin, the optimal range we look for is 50 to 100. So and that's your iron storage. So if your number isn't 50 to 100 and you're having thyroid issues, you're going to want to replace iron and get that to an optimal level. Vitamin D, we check that vitamin D level. Homocysteine, and get your vitamin D from 50 to about 50 to 60, your vitamin D level. Homocysteine can be a toxin in high amounts, but when it's high, it tells you that you're not what we call methylating, which can be an indication you don't have enough B vitamins. So if that level is high, if that level is greater than 7, then you can consider giving them an activated B vitamin. And then selenium is needed, and a lot of soils don't have enough selenium. So you could check a selenium level, just a regular selenium level in the blood. And if that level isn't high, if it's kind of within normal range, you can always do a trial of selenium. And if your TSH is high, meaning the thyroid can't make enough thyroid, sometimes we'll give people just a small amount of iodine, and we always follow up with blood work to make sure that it doesn't make them overactive with thyroid, because iodine potentially could be or iodine is needed to make thyroid hormone, but your iodine level may look like it's okay, but it's not okay. And the reason is that if we go back to our school, the periodic table, you had the halides in the periodic table: bromine, chloride, fluoride, and iodide, and all of those look very similar. And what happens is that we have chloride and fluoride and bromide throughout. They kind of dumped them into our environment. We're consuming them and taking them up, and they look very similar to iodine. And what happens is that our tissue will take them up instead of iodine. So sometimes what you got to do is give a little bit of iodine, just so that the concentration of iodine is a little higher, not too high, but enough so that it can go into those tissues, go into breast tissue, go into thyroid tissue, go into the different tissues it needs. So I think with from a supplement, just making sure the thyroid has what it needs, that's kind of the nutrition that we're looking for.
Oh, definitely. What other factors do you like to look at as well? I mean, we mentioned stress. Stress is big, and then of course all the other.
Yeah. So if that reverse T3 is high, or the ratio is off, the total T3 reverse T3 ratio is off, then or abnormal, then that's telling me that they're under stress. So number one, will point it out and say, look, it could be stress on the body, but it also can be psychological stress. So we work on mind-body stuff and whatnot. Sometimes we'll work on, we'll double check the adrenal glands. So we'll have them do saliva cortisol testing, so we can
That's one of
see.
my favorite testings too.
Yeah, where you check in the morning and then,
Yep.
yeah, yep. So we can do our saliva cortisol testing, and if that's high, there's a supplement called phosphatidylserine that can be helpful. You could also give them something called L-theanine that comes from green tea that helps relax you. You can give them things like GABA. You get their magnesium levels. You give them B complex. So you kind of work the adrenals, and then you work on stress management and mind-body stuff. And I know you're really big into that. And you can watch that thyroid. You can watch that reverse T3 levels come down and the total T3 levels go up. And then there's one of my favorite supplements, really, when it comes to this, is going to be ashwagandha. Ashwagandha helps with stress, but it also increases the different thyroid components.
So good. How do you like to use it? A little behind the recommendations. Do you use it in a tablet form? Do you like to use it like in a drink, like powder form? How do you like to use it?
I usually just have them take a capsule twice a day.
Yeah, easy. Just swallow it. But mixing it into like a drink tastes better.
Yeah, no, hey, is that something you're doing? Having them drink
Yeah,
ashwagandha?
sometimes, yeah. But
Okay.
again, like people just rather just swallow the pill if they don't have time to like sit down and really slow down the nervous system and drink the ashwagandha. But
Mm.
yeah.
So then if their T4 is not converting well to T3, the two main nutrients that can cause that is going to be selenium and zinc. So selenium and zinc deficiency. So you can always do a trial of selenium. You can always do a trial of zinc. And sometimes what I do is I check a zinc to copper ratio. And if your zinc and copper should be 0.8 up to 1 to 1, meaning that for every 80 of zinc, you can have 80 to 100 of copper. If the copper is really high and the zinc is low, then I'm going to think, hey, we need to put you on some zinc. And then what we also look at is those thyroid antibodies. And this is something that most conventional practitioners aren't even going to look at. They're going to say, look, you can have the antibodies and it doesn't mean anything and we don't need to do anything with it. And to me, it's like, no, hold on. If you have high thyroid antibodies, that means that the body is attacking itself. And autoimmune conditions, they work together, meaning that you usually don't just have one autoimmune condition. Your body had the perfect storm to attack itself. So what do I got to work on? I got to work on getting your vitamin D optimized. I got to work on probiotics, things with bifidobacterium and lactobacillus to stop the body, that perfect storm from the body attacking itself. I want to work on things like gut health and eating healthy. I want to work on all of those things. And then you mentioned gluten. Gluten, there's something called molecular mimicry, where the body there's a region on a food that looks very similar to a region in your body. So like gluten can look like thyroid, and the body will attack that region when you're eating the gluten, and it'll turn around and attack the thyroid. So sometimes we put them on an elimination food plan. And then one of the things I really like if they have thyroid antibodies is to either have them have 2 to 3 Brazil nuts a day or to take 200 micrograms of selenium, because there's research that shows that selenium can lower those thyroid antibodies as well.
I'd rather take the Brazilian nuts.
Right. I usually tell people take the Brazil nuts, and then they come in and like, have you been taking 2 to 3 a day? And they're like, nope. So I'm like recommending again. Then I'm like, all right, I'm going to put selenium on your chart. And what we're going to do is you take the selenium, and the day that you eat those 3 Brazil nuts, don't take your selenium. So I kind of flipped it because they just keep coming back, not eating the Brazil nuts. It's a little bit, but
it's mind-boggling. But I mean, it shows you food literally is medicine, or it's not. It could be the worst, the culprit.
Right. And then I think what we didn't talk about yet is and this is something that you got to get with a licensed practitioner. This is all, of course, for entertainment, educational purposes, and you got to find somebody that really knows how to manage this. But you mentioned Synthroid, the most common thyroid hormone that you would give someone, and this is for people with a high TSH. So now it's not that the thyroid, because this is where people I think get confused. Either the thyroid isn't making enough thyroid hormone because your body's under stress and you're trying to conserve energy, right? So that's why you feel like that, because you're in this chronic state of stress. So the body's just trying to do its thing and try to conserve. But then the other thing is that the thyroid gland can actually burn out and it can't make enough thyroid hormone. And how do you tell that? Usually you're going to tell that when that TSH goes high. That signal from the brain saying you need thyroid. And when that's up, now you know there's like a failure of the thyroid gland. And that's where you can try giving them the nutrients that they need, like iron, if it's low, maybe a trial of iodine. But at some point, you may have to give thyroid hormone. And I start with Synthroid, the T4, And I know that T4 needs to convert to T3. So you start with the T4, you give them a small dose, you recheck it in about a month, and when you check it, you check your panel again. And then you look at the T4, you look at T3, so the free T4 and the total T3, and then you look at the ratio. And if the ratio is off, and the patient still feels symptoms. If they feel great, leave them alone. But if they still feel symptoms, they may have something described in the literature, in the conventional medicine literature, as T3 resistance. And that's where they inadequately, or they're not good at, genetically turning your T4 to T3. And that's when I will give them a small amount of T3. It's called liothyronine, and you kind of break it up, and you do half of it in the morning, and then half of it in the afternoon, and then recheck a level in about a month. And then you slowly adjust either the T4 to drive down the TSH, and to drive up the T4 level, or the T3, which can drive down TSH, and it drives up the T3. And you work on getting the right ratio. Now, I know a lot of people use Armour Thyroid. I personally do not. Maybe I have a couple patients that were on it and they're staying on it. And the reason is that I like to be able to control the amount of T4 and T3. I don't, Armour Thyroid, or the different, they're called glandular thyroids. They have a set 4 T4 to 1 T3, and it's ground up pig thyroid. But human thyroid has about 10 up to 13 to 15 T4 to 1 T3, which means that pig thyroid combinations have way more T3. And if you have too much T3, then you can also get all the signs of thyroid overload. So they can get anxiety, and they can get they can get palpitations, and they can get irregular heart rhythms, and they could end up thinning their bones. But like I said, we have some patients on these glandulars, but most of them, we are starting with T4, and then we're adjusting the T4 and the T4 and adding a little bit of T3, and we're getting them within range, and we're looking at their symptoms as well.
Oh, such a good full picture of this. Is there a unique case or a favorite case that you can think of that you would like to share?
Thyroid, honestly, thyroid is one of those things that there's so many. If people know what they're doing with thyroid, you can get people feeling so well. Multiple cases come to mind. But I'll tell you, I can think of even early on when I was doing this, a particular patient of mine who was she kept being told, your numbers are fine, you're fine, you're fine. And when we dug deeper, we saw that her T3 was low, and the ratio was low. So we gave her T3, and we did all the nutritional stuff, and we did all this other stuff. So we gave her the T3, and then she felt a little bit better. And we actually normally we give it twice a day, the T3, because of the way that it peaks and then it drops and then it peaks. So then you give another dose, so it peaks and drops. But we ended up finding the perfect dose for her, where she would take it 3 times a day. And sometimes it's hard to take things 3 times a day, but she felt phenomenal. It completely changed her life. And I can think of another patient that came to me, and they had what we call Hashimoto's, which is one of the most common autoimmune disorders, and it's one of the most common causes of thyroid disease. It's where the body's attacking the thyroid gland. And by going on a functional medicine approach, by working on the autoimmunity, by giving a bit of iodine, by giving the nutrients, she went from the TSH being high and her having hypothyroid to, without any medicines, her thyroid went away. And one other case came to mind. I have a patient who all I did is gave her a little bit of iodine, and her energy came up, and her weight just kind of continued to fall off. And she ended up with her ideal body weight, because genetically she was missing she needed more iodine than other people, most probably, and she was just missing iodine. So there's 3 cases.
Just 3, and I'm sure there's more. Isn't that amazing that when you really use this lens and get to root cause, that you, in a way, give people their life back in a sense. It really makes a change. And I just love that. I think that's why it's so important for practitioners out there to keep doing what we do. And hopefully, slowly I also see a change in my conventional colleagues. I don't know if there's like still resistance where you practice in Florida, but here in Texas, I mean, in the hospital setting, there's more people that are like, yeah, I mean, use the combination of just the bandage approach and just the burnout. They're seeing that there's a whole other lens that makes a change in patients' lives.
Yeah, they are, and I think there's a couple of reasons for that. Because when I was training, I did residency in 2002, and I did med ped, so it was a 4-year. And when I was training, there was such a block. Like, there is nothing to natural medicine. My attendings actually made fun of natural medicine. I heard things like, if they asked me about garlic for cholesterol, I show them the door and say, "Get out. This is not a natural medicine office." And there's been such a shift. And what was really drilled into us was there's no research on any of this. It's not evidence based. And what was drilled in my head was evidence based. And once I figured out that there was research on it, it was just not brought to the forefront of our attention, and that this is evidence based. It helped open my mind. And I think with time, what happens is that we as physicians, we're also human. So we also end up with the same with the same diagnoses that our patients do. And after a while, we're like, this approach of just giving ourselves medication and feeling like crap, but happy that our numbers are good, it ain't lasting. It doesn't feel right. It doesn't feel like a right approach. So I think there's that shift. But I think one of the major shifts is with the internet being the blessing and curse that it is, and having access to research and access to information like your podcast. What's happening is that patients are demanding more. That whole, I'm going to the doctor tells me whatever the doctor says I do, they are my boss, and I do whatever the doctor says. Those days are gone. The doctor is a guide, and you got to listen to what the patient is talking about and what the patient wants. And most people want a more natural approach. They don't want to say, just tell me what drugs I need to feel better. You get those patients too, and we get them to go on a walk or something. You meet them where they're at. But more and more patients are just wanting better. They're wanting better quality.
Exactly. It's about meeting people where they're at and the shift that's actively happening. And this has been so amazing. And I can't wait to continue to part 2, 3, 4 and the upcoming collabs. Hopefully we brainstorm on. So this has truly been a pleasure. I'm honored to have you on, and thank you so much for sharing your time and knowledge.
Oh, thank you for having me. My pleasure.
If you enjoyed today's show, share with your friends and family, and of course, subscribe. Thank you so much for your support.